Come in.
Hi, Katie.
Hi.
I'm Dr. Mad. I'm going to do your examination today.
Nice to meet you.
Nice to meet you too.
Yes.
Can you please verify your first and last name and your date of birth?
Sure, it's Katie ASMR, and it's March 19th, 1990.
Okay. Perfect. Do you have any allergies to medications?
No.
Okay. And what's going on? What brings you in today?
So I'm having some nose problems. About a month ago, I was cuddling with my puppy in bed, and she scratched like the inside of my nose right here, like this, like digged her claw in.
Okay.
And ever since then, it's been sore. But also, I've had like weird things going on with smell.
Okay.
Like sometimes I smell like a smoky smell, and there's no smoke around. I'll ask someone next to me, like, "Do you smell that?" And they don't.
Okay.
Or something metallic, even. So I don't know what's going on, but I would like to get that checked and see.
Okay.
Yeah.
How long ago did this happen?
About a month ago, so I've been kind of delaying coming in.
Okay. And do you feel it's swollen?
It feels tender. I'm not sure if it's swollen, but it definitely, when I touch it, it feels sore.
Okay. On a scale of 0 to 10, how bad is it?
It's about a 6. Yeah.
Okay. Have you noticed anything coming out of it?
No.
No discharge. So we're definitely going to go ahead and look at your nose and see what's going on inside. And maybe we'll just need to prescribe some antibiotics.
Okay.
It is very common to have that abnormal sense of smell after an injury, but we're going to take a look and see what's going on as well.
That'd be great.
All right, have you noticed anything changes with your vision?
No.
Okay, that's a good sign. Any changes with your hearing?
No.
Okay. And any abnormal senses on your face, like any numbness or tingling sensations?
I would say a little bit of numbness, like around the nose area here.
Okay.
Yeah.
Okay. And are you experiencing any pins and needles in your fingers or toes?
No.
Okay. Any problems with your balance?
No. I mean, I'm usually a little bit.
Okay. And lastly, it's any changes with your taste?
No.
Okay. So part of the exam is a cranial nerve examination. We're going to test all 12 cranial nerves. Are you taking any medications on a daily basis?
Yes, I'm taking Wellbutrin and I'm taking trazodone at night to sleep.
Okay. And any other injuries to the face or head?
Not that I remember.
Okay.
No.
All right. I'm going to take your blood pressure. So we're going to put this on your right arm, right upper arm. I'm going to have you uncross your legs, please.
Sure.
Thank you. Any chest pain or palpitation?
No.
Okay. Go ahead and relax your arm. Okay, blood pressure is 118/65.
Okay.
Have you experienced any flu-like symptoms?
No, not lately.
Okay. 98.5. And I'll take your oxygenation as well. Go ahead and relax. Okay. 5 Fahrenheit. Heart rate is 75. Oxygenation is 99% on room air. Blood pressure, we said it was 118/65. Okay, very good vital signs. I'm gonna have you change in a gown,
Okay.
and I'll start the cranial nerve exam.
Okay.
Okay, I'm just going to put gloves on. And I'll start by palpating your face and also your neck.
Okay.
Feeling for any bumps, any asymmetry. Any lymph node enlargement. I'm not feeling anything swollen in the orbital area. The nasal cavity is connected to the orbital cavity as well, and going to the nose, so that's to the ears I meant. So that's good that there's nothing swollen. I'm gonna go ahead and slowly palpate your nose. Okay. It does feel a little bit swollen on the right side. Alright, I'm gonna go ahead and check your smell. So I'll have you look up, looking for any redness or fissures. It's a little bit of redness there. Just comparing it with the other side. So the midline It's a little bit red. Also, the nostril seems to be a tiny bit moved, shifted. Okay, so we're going to jump right into the smell evaluation. I have here a few samples. I'm going to have you close your eyes and cover one nostril for me, please. Perfect. Go ahead and tell me if you can identify the smell.
Licorice.
Okay, go ahead and cover your other nostril.
Lemonade.
Okay, that was cinnamon. Alright, now go ahead and leave both ears open and try to identify the smell.
Chlorine. It smells like chlorine.
Okay, this was vanilla.
Honestly, it smells kind of like whiskey, but I know
Yes.
it's not. Oh, okay.
Yes, that was good. Okay. So it seems to me that more of the sweeter stuff you can't distinguish. Let's go and keep trying.
I can't smell that at all. Okay. Sorry.
That's okay. No reason to be sorry. Okay.
It smells like soap.
Yes. Okay. Alright, I'm going to check your mouth now. Can you please give me a big ah? Say ah. Good. You've left midline. I'm not noticing any shifting, so that's a good sign. I'm gonna have you move your tongue up and down for me. Okay, side to side. Good. What I'm gonna do is I will put this blade inside your mouth. Go ahead and open. And now try to move your tongue that way and the other way. Okay. And one more time. Good. Alright. Let's go ahead and check your taste. So what I'm going to do is I'll put a small paper on your tongue. And I'm going to have you taste it and tell me what that tastes like. Okay. Okay, go ahead and give this a taste. Just tap, tap.
Slightly minty, but honestly, mostly paper.
Okay. Yeah, so all of them are going to taste a little bit like paper.
Okay.
But I'm looking for
That's true.
identifying that taste.
Okay.
Okay.
Sugary, very sweet.
Okay, good. This is the...
Tasted like something I shouldn't be tasting.
I'm so sorry.
It's like chemical-y, kind of.
Okay.
Yeah.
Yes,
Like
that was the bitter one.
Yeah.
And I can give you some water after this
Thank you.
to rinse your mouth.
Okay. That tasted just the same.
The same as the last one?
Mm-hmm. Yeah.
All right. So smell on the right nair and taste was normal. Okay. I'm going to check your hearing as well. So go ahead and close your eyes and tell me with which ear you hear the sound.
Left. Right. Both.
Okay. I'm going to make a vibration sound with a tuning fork and I'll put it behind your ear. Go ahead and tell me when you don't hear the sound anymore.
Okay. Stop. Stop.
Okay. Now go ahead and tell me which position here is louder. Position number 1 or 2.
2.
Position number 1 or 2.
2.
2. Okay. Okay. I'm gonna have you look straight in my nose. I'll flash a light in your eyes. We're checking pupil dilation. Okay. Now go ahead and look right here for me. Okay. And now look this way. Okay. Good. I'm gonna have you cover one eye. Alright. And with the other hand, can you please grasp the Snellen chart? Extend your arm all the way. Can you please tell me what letter you see here?
E.
And here?
C.
And here.
L.
Alright, I'm gonna have you read the last row starting with the letter L.
L. T. F. P. H.
Okay, good. Go ahead and switch eyes for me.
Okay.
What letter do you see here?
O.
And here?
J.
And here.
H.
Alright, go ahead and read the last row starting with the first letter to the right.
H. P. F. T. L.
Okay. Alright, Kitty, I'm going to have you lift your head up a little bit. Okay. And I'll do the same thing. I'll start by palpating your face and your neck. Okay, palpating mastoid bone. Any pain here?
No.
Okay. Okay. Now I'm going to press down on your sinuses right below your eyes. Let me know if you feel any kind of pain as I'm doing this.
Just a little numbness on the right side.
Numbness on the right side.
Yes.
Alright, so I'm going to go ahead and do some testing. Okay, go ahead and tell me if you feel this on the left or right.
Right.
And now.
Left. Right. Left. Left. Right. Right.
Tell me if you feel this cold or warm. You didn't feel that at all?
No. Cold, but I felt the handle here. Okay. I didn't feel anything.
Okay.
Cold. 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 Cold.
Okay. Go ahead and tell me if you feel this sharp or dull. This is what dull is going to feel like, and this is what sharp is going to feel. Okay, does this feel sharp or dull?
I don't know.
What about now?
I think that was dull.
Okay, do you feel the same dullness on both sides? Does it feel equal?
I feel more on the left.
Okay. And does this feel sharp or dull?
Dull.
And what about now?
Sharp.
Okay. Alright, I'm going to tap on your face. I'm going to see if there are any abnormal neurological responses. So tell me if you feel any pain. Okay. Go ahead and relax your lower lip. Okay. I'm noticing some hyperactivity here, which is a neurological response. Go ahead and tell me if you feel this on the left or right. And did you feel that equally on both sides?
Yes.
And did you feel that equally on both sides?
No, I felt it more on the left side.
Okay. What about now?
Equally on both sides.
Alright, so what I'm going to do now is I'll do a scalp exam as well and take a look and see if there is any numbness there as well. I'm going to have you lift your head a little bit higher. So move your whole body a little bit higher towards me. Good. Perfect. Okay. you please tell me if you feel this cold or warm?
Cold.
And is this the same amount of coldness?
Yes.
What about now?
Yes.
Okay. Go ahead and tell me if you feel this sharp all the way.
Yes.
What about now?
Yes.
Can you please tell me if you feel 2 or 1? Okay. Can you go ahead and tell me if you feel this on the left or right?
Right. 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 Left.
Okay. 2 or 1?
2. 2. 1. 1.
Okay, does this feel cold all the way?
Yeah.
And does this feel sharp all the way down?
Yes.
And all the way up?
Yes.
Okay. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. Sharp. Sharp. Sharp.
Okay, can you tell me if you feel this on the left or right?
Right. Left. Middle. Right. Right.
Okay. Does this feel cold or warm?
Warm.
Do you feel this on the left or right?
It's on the right. Right.
Does this feel sharp?
Yes.
And no?
Yes.
And no.
Yes.
Do you feel this sharp all the way down?
Yes.
Okay. And does this feel sharp or dull?
Dull.
And no?
Dull. Dull.
Okay. Do you feel this sharp or dull?
Sharp.
Is this the same intensity as the first one?
It's a little duller.
What about now?
Yeah.
Do you feel this on the left or right?
Right. 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 Right.
Okay. Alright, so I'm gonna have have you flip on your belly and I'll take a look at your back and neck.
Okay.
Okay, can you please tell me if you feel this 2 or 1?
1. 1. 1. 1. 2. 2.
Okay, and go ahead and tell me if you feel this on the left or right of your partition.
Left. Right. 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 Right.
Okay, go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp. Sharp.
Does this feel cold or warm?
Cold. Cold. Warm. Warm.
And does this feel sharp to you?
Yes.
And now?
Yes.
And now?
Yes.
Okay. Now please tell me if you feel this on the left or right of your partition.
Right. 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 Right.
Please tell me if you feel this all the way down.
Yes.
Does that feel sharp or dull?
Sharp.
Is this the same amount of sharpness?
Yes.
Okay. Does this feel cold or warm?
Cold. Cold. Cold.
And can you please tell me if you feel this on the left or right?
Right. 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 Right.
Okay. Alright, I'm gonna have you flip your head that way. Okay, Katie, I'm just gonna go ahead and open the gown in the back. We'll repeat the test that we've been doing to make sure that there's no neurological positive response. Looking for any fractures. Can you please tell me if you feel this on the left or right?
Right. Left. Left.
Okay, go ahead and tell me if you feel this cold or warm.
Cold.
Okay, I'm going to slide it down the back along the spine. Please tell me if you feel any change in coldness.
No, it's the same. It's the same.
Okay. Go ahead and tell me if you feel this on the left or right.
Left. Left. Right. Left. Left. Right. 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 Left.
Okay. Alright, I'm going to touch you with two objects. So this is what two is going to feel like. And then with one, this is what one is going to feel like. So go ahead and tell me if you feel two or one.
Okay. Two. Two. One. 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 Two. One. 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 One.
Okay. Now I'm going to touch you with a sharp object and a dull one. This is what dull is going to feel like. And this is what sharp is going to feel like. Go ahead and tell me if you feel sharp or dull.
Dull. Sharp. 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 Dull. Dull. Sharp. Sharp.
Go ahead and tell me if you feel this sharp all the way.
Yes.
And now.
Yes.
Okay. Alright, I'm going to have you sit up and I'm going to discuss the results.
Okay.
Okay, Katie. I was able to notice that there is some numbness around your nose for sure, and along your back. I did notice there is some slight inconsistency with your answers. I think we're going to have to order just some more tests to figure out what is going on. It's possible that the scratch could have caused some nerve paralysis, which is something that goes away within time. 3 to 6 months it might take. And otherwise I did not see anything abnormal, so that's a good sign.
That's good. that makes sense. Thank you.
All right, just one more test that we're going to do, a CT of the spine and neck. This is just to rule out anything that we cannot see or do a test for. And I'll call you back with the results within 48 hours, okay?
Okay, thank you.
You're welcome. Thanks for coming. I'll see you soon.
All right, see you. Bye.
Okay. I'm going to first take a look at the hairline. And today I'm going to do a scalp treatment as well. But the main focus would be scalp and hair. We're definitely looking for some inflammation and see if there's anything that we can do to detoxify and reduce any swelling. Taking a look at the base of the hair. I'm going to take some measurements first. I'm noticing a little bit of swelling. That definitely goes towards the center of the scalp. Just slowly tapping. We're looking for any neurological disorders, something that would definitely be shown in the main cranial nerves. I'm looking for any pulsations or changes. taking a look at the skin, I'm noticing a little bit of flakiness, dry skin, something very similar to eczema. So we're going to look into a treatment to increase the gland secretion. So looking at circulation and see if I'm noticing any redness as I'm pressing down on the scalp. That could mean a lack of oxygenation. Okay, I'm gonna have you flip over. Okay, I'm going to go ahead and expose the hairline at the back of the neck. I'm going to go ahead and brush the hair. Noticing a little bit of redness at the base of the skull, and it looks like it's a scar. Any injuries?
No, not that I know.
It does look like you have natural wavy hair, and I'm not seeing any signs of alopecia at the base of the skull. Definitely going to take a look everywhere and see if there's anything abnormal. The skin is a little bit flaky. I was expecting this. I'm noticing some papules here and there. It's very similar to a light case of eczema. I'm going to take a sample And see if we're seeing anything abnormal. Okay. I'm going to touch you with 2 pressure points or 1. This is what 2 is going to feel like. And this is what 1 is going to feel like. Go ahead and tell me if you feel 2 or 1.
1. 1. 2. 1. 1. 2.
Now tell me if you feel this cold or warm.
Cold.
You know?
Cold. 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 Warm. Cold. Warm. Cold. Warm. 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 Warm.
Notice a little bit of redness here. Have you noticed any kind of itchiness on the right lower side of your scalp? going to apply an essential oil that will help the muscles in the back of the neck to relax. I'm just going to go ahead and rub it. Make sure that it is absorbed properly by the skin. This will also help to reduce inflammation in the area and any redness. I'm going to use the sensory brushes to desensitize the area before we start massaging it. This will help to automatically increase blood flow. We're also focusing on the neck and upper back, spinal cord. This helps to decrease cortisol levels and balance the nervous system. I'm going to apply acupressure using pressure points at the base of the skull to release any toxins that have accumulated in the area. Focusing on the mastate bone as well. applying a lotion that helps with any rheumatic pains. So it's targeting mainly the upper spine. Going to apply cold acupressure. So this is going to feel a little bit cold, okay? I'm going to perform hair pulling therapy. It's going to help with the trigger points in the back of the skull and to release any of that tension that you are currently feeling. releasing some of that tension that sometimes gets built up behind the ear. Hi Katie.
Hi.
My name is Dr. Matt. How are you feeling today?
I'm feeling pretty good overall. Yeah.
Okay. I see here that you made your annual appointment.
Mm-hmm.
Okay. Can you please verify your last name and your date of birth?
Sure. It's ASMR and March 24th, 1989.
89 you said?
89, yeah.
Okay. Do you have any allergies?
No, not that I'm aware of.
Okay. And are you taking any medications on a daily basis?
No, not right now.
Okay. Have you had any surgeries since the last time I saw you?
No.
Okay. And any injuries?
No injuries. I do have a tightness in my neck, and it radiates down here.
Okay.
And I don't know if that's going to go away on its own, but it started yesterday. I was giving my puppy a bath, and I was just in this weird ankle trying to just like get certain corners of her while she was moving around. And I don't know why, but after that, just kind of like really intense strain whenever I move my neck.
Okay, so moving neck.
Yeah.
And how bad was the pain, or was it
It's
on a scale of 0 to 10?
like a 7. Yeah.
Okay.
It's very noticeable when I move.
Okay.
Mhm.
And was it sharp? Was it radiating on one side more than the other?
It's like it gets really sharp, and it's just on my left side. It gets really sharp whenever I like turn my head and rotate it.
Okay. Are you experiencing any pain in your hands or feet?
No, no, I can feel it too. My shoulder, my upper shoulder, and then it stops.
Okay. Are you having any abdominal pain?
No.
Discomfort?
No.
Okay. Any lower back problems?
No, I don't think so.
Okay. And if you try to touch your chin with your chest like this, are you having any pain down the spine?
So, right when my chin hits here, it starts to hurt. Like right here. Yeah.
Okay. And is it traveling down the back?
It's just in that area on the left side.
So
That,
still
yeah.
localized. Okay. There you go. I'm going to take your temperature. This will go on your forehead. And this will go on your index finger. We're going to do a very thorough checkup, make sure that we have all the vital signs. Good. And I'll take your blood pressure. Go ahead and use this one. I'm going to have you uncross your legs. You do have a tendency to have low blood pressure, so let's see how it looks today. Okay, blood pressure is 108/65. It's not too low, so that's a good sign. And oxygenation is 98, heart rate 72. All vital signs look very good. I do not have any concerns. Okay, I'm gonna have you change in this gown and we're gonna go ahead and begin the examination. Sure. So go ahead and have this closing in the back.
In the back, okay. Great, I'll be right back.
I'm gonna go ahead and take some measurements. So we're going to check head circumference, making sure that everything is symmetric. And I'm gonna go ahead and check your arms as well. Perfect. And I'm gonna have you put your arms like this for me. Okay, very good. I'm gonna have you close your eyes, and can you please tell me if this feels equally on both sides of your head? Do you feel that equal?
It's hard to feel it at all, actually.
Okay.
Yes.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
No. 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 No.
Okay. Go ahead and tell me which position here is louder. This is position number 1 or 2.
2.
And this is position number 1 or 2.
2.
Okay, doesn't seem to be any problems there. What I'm gonna do now is I will gently tap on your face. Let me know if you feel any kind of pain. We're trying to see if we can elicit any type of neurological responses. Okay, so that was 1. Every time we keep on tapping on the face, we're waiting to see if there are any movements, and it should be less and less as we keep on tapping. All right. Go ahead and relax. Good. Perfect. Okay. Okay. Diminish response on the left side. Good. Good. Okay. I'm going to touch your face with two objects in the same time. I'm going to need you to tell me if you feel them equally on both sides, okay?
Okay. Yes. 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 Yes.
Okay. And now I'll touch you with two objects. One is going to feel sharp. Go ahead and extend your palm for me. I'm going to show you what sharp is going to feel like. And the other one is going to be dull. Okay?
Cool.
So go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull. 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 Dull.
Okay. I'm going to go ahead and palpate your hand. So we're looking for any lumps or asymmetry. Okay, I'm gonna have you turn your head this way. We're feeling lymph nodes as well. going to check your arms as well for any swelling. Okay, go ahead and open your eyes. I'm going to have you look straight at my nose. I'm going to flash a light in your eyes. We're looking for pupil dilation and constriction. Okay, I'm going to have you follow the light with your eyes only. Don't move your head. Very good. Now go ahead and look right here for me. A little bit higher. Okay. Going to palpate your sinuses. Looking for any swelling. Check hydration. Gently pressing down, see if there's any redness, slight edema. Okay. I'm going to listen to your heart and lungs. I'm going to take this, put it over here. Is it okay if we open 2 of these buttons?
Yes.
Okay. can hear a slight murmur. Also S1 and S2, but I'm a little bit concerned about that extra sound, so let's go ahead and check with the diaphragm as well. Yeah, we're gonna need to do further testing for that murmur. Go ahead and take a deep breath in and exhale. And again, take a deep breath in and exhale. Okay, go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Let's do that one more time. Take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay, I'm going to check for jugular vein distension as well. And we're gonna have to listen to see if there is any external sound, any brewy, which is an indication of some circulation problems. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. And we have to check on both sides. Take a deep breath in for 1, 2, 3. Good. Okay. So I would like to check your back now. I'm going to have you turn around facing the window there. Let's go and close this. Okay. Okay, I'm just going to put your hair up and we're going to take a look at your spine. Okay. Open the gown in the back. And I'll start by palpating mastoid bones, which are right behind your ears. Feeling for any swelling, any edema, signs of inflammation. Moving down to the first occipital bone. And here we're going to make some movements as I'm palpating your neck. I want to see how the muscles are working together and if there is anything popping out as you're moving your neck, okay? Go ahead and touch your chin with your chest. Very good. On the left side? Yeah. Alright, so we're going to make a scale. It's going to be from 0 to 3. 0 is no pain, 3 is a lot of pain, 2 a little bit less, and 1 not so much pain. So right now on a scale of 0 to 3, how would you rate this? Okay. Go ahead and come back to normal. And now try to touch your left shoulder with your left ear. What number is it?
That's a 0.
0. Okay. Let's do the same thing with the other side. What number is that?
3.
3. Is it on both sides or just one?
It's just on the left side, and it's like right down here. So it's not as far as it's like right down like inside of my shoulder.
Okay. Okay. Come back to center. Right, I'm gonna have you lift your left arm up 90 degrees with your body. Go, go, go. Perfect. Okay, so now it's smoothing this side up, and I'm feeling a lot of tightness in this area. Very little spine mobility as you moved your arm up. Okay, bring it back down. And we'll do the same thing on the other side. How's the pain now?
It's not that bad because you're touching the other side. It was really painful here, but not here.
Okay. Go ahead and bring it back down. And what I'm going to have you do now is to try to make an S with your spine. So you bring your shoulders forward. Perfect. Okay. So we're taking a look at the spine, see if there are any abnormal curvatures. And right at T1, your spine is shifting to the right side. So that makes a lot of sense why you're feeling all of that pain. And it's right in this area. So your spine goes straight, normal curvature, and then boom, shifting to the right side, right over here at the junction between the cervical and thoracic. Come back to normal. Okay. And it's not so evident as you're sitting like this. It's more evident when you lean forward in that position. All right, we're going to tap on your spine, see if there is any kind of pain as I'm doing that. And let me know if you feel any kind of shooting sensation down the spine, especially here as we're approaching that space. Yes. Tell me when it stops, okay? Right here. Yeah. Okay. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull. Sharp. Dull. Sharp. dull, sharp, sharp, dull, sharp, sharp, dull, dull, sharp, dull, 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 sharp, sharp, dull, 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 sharp, sharp, dull, dull. I couldn't tell. Sharp, 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 dull, sharp, 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 dull, dull, sharp, dull, 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 sharp, 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 dull, dull, dull.
Okay, very good. All right. Okay, I'm gonna have you lay down and I would like to take a look at your scalp
Okay.
and see if there is any sensory problems there too.
Okay.
Go ahead and take a look at your hairline first. I'm not seeing any redness. Some alopecia on the right upper side, and there's no sign of hair lice on the left side. Can you go ahead and tell me if this feels cold or warm?
Cold. 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 Warm.
Okay, does this feel cold on all three parts? That's 1, 2, and 3.
Definitely 1 and 3.
And this doesn't feel cold.
A little bit, yeah, it does.
Okay, go ahead and tell me if this feels sharp or dull.
Sharp. Sharp. Dull. Sharp.
Does this feel sharp all the way?
Yes.
Does this feel sharp all the way?
Yes.
What about now?
Yes.
Okay. Does this feel sharp or dull?
Dull. Dull. Dull.
Does this feel cold or warm?
Cold. Cold. Cold.
Go ahead and tell me if this feels sharp or dull.
Dull. Sharp. Sharp. Dull. Dull.
I'm gonna have you turn your head this way for me. Does this feel sharp or dull?
Sharp. 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 Dull. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Okay. Does this feel cold or warm?
Cold. 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 Cold.
Okay. Go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. Warm. Cold.
And does this feel sharp or dull?
Dull. Sharp. Sharp. Warm. Sharp.
Okay, is this cold or warm?
Cold. Warm.
Is this sharp or dull?
Dull. Sharp. Sharp. Sharp.
Okay. And does this feel sharp all the way?
Yes.
Okay, very good. All right. I'm gonna have you sit up. Okay, good. There were some problems with your scalp, and also I heard a murmur on the heart. Sounds a little bit concerning, but let's go ahead and just make more checks, more tests, and see if we come up with a diagnosis.
Okay.
The good thing is that you're feeling good right now, so you don't feel any problems with your heart. And also the neck and shoulder pain is a little bit concerning, so we're gonna send you for some x-ray just to double check and see if there is any deviation or need for surgery or anything like that. All right, and I'll let you know, and we're going to have a consult with a neurosurgeon. And for the scalp area, I just recommend some exercises for now to make sure that we stimulate and we bring a lot of blood flow to that area, okay? So the problem that I noticed more was on the right side.
Okay.
Right upper side. Okay. Seems like I'm throwing a lot of things at you right now. I'm so sorry. Do you have any questions for me?
It seems like a lot. Is there a chance that the heart issue is minor, or that, it sounds like it could be serious? Right.
Heart problems, yes, they can be something that we definitely need to address. I can't tell right now how serious it is.
Okay.
Sometimes people are born with a murmur and they've had it all their lives and they don't know about it. And sometimes you can come to check up, hear the murmur, and go to the next one and not even hear any murmurs.
Okay.
So that's why I'm saying it could be something, but in the same time, let's just not jump to any conclusions.
Okay.
Do some more checkups and see if it's indeed something to be worried of, okay? I'm not worried about it right now, so don't be worried yet. Okay. All right. Perfect. Well, if you don't have any more questions, I'm going to let you get dressed and I'll see you up front.
Okay, thank you.
Hi, my name is Dr. Mad.
It's nice to meet you.
Nice to meet you too. How are you doing?
I'm okay. Not too bad.
So you're here for your annual physical?
Right, correct.
Okay. Can you please verify your date of birth and your last name?
My date of birth is October 28th, 1999, and my last name is Frank.
When was your last physical?
It was about a year ago.
Any concerns that you would like to address again?
Yeah, high cholesterol runs in my family, and I'm just a little concerned about prehypertension.
Do you have any allergies to medications?
Penicillin.
Okay. Do you have any thyroid problems?
No, I don't.
Okay. Any abdominal discomfort?
Not at the moment.
Are you experiencing any pain anywhere in your body?
I have headaches sometimes, so that's a slight concern, but besides that, no.
Okay. How often are they?
I'd say twice a week, sometimes
That's
3 times.
pretty often.
Yeah.
All right. Have you noticed that they're more frequent at night or in the morning?
Usually in the morning or afternoon.
Okay. Do you think they might be triggered by something you eat?
I'm not
Diet
sure.
related?
Sometimes on the days I have coffee, it could be related to that.
Yeah, definitely dehydration can cause migraines. But we're going to do a neurological assessment as well just to make sure that nothing else is related to it.
Okay.
Are you taking any medications?
Not at the moment, no.
Okay. Okay, and you're not taking multivitamins at all?
No.
Okay. Any surgeries?
I did have appendicitis, but that was 5 years ago.
Okay. Any breathing problems?
No.
Okay. When was your last pap smear?
It was a year ago.
Okay. So you are not due for one yet. We will have you scheduled for this next year.
Okay.
Okay. Any head injuries?
No. No.
Any problems with your back? Are you experiencing back pain?
No back pain.
Okay. Okay. I'm gonna go ahead and take your vital signs. I'm going to take your temperature. Have you noticed any flu-like symptoms?
Not recently, no.
Okay. All right, I'm going to place this under your tongue and I'm going to ask you to hold it for a few seconds. Go ahead and hold it for me. Perfect. And then we'll place this on your right arm. Okay. 97.1. That is good. Did you have anything to drain before you came in?
I had some water.
Okay. Was it
Yeah.
room temperature?
Yeah.
Okay. Actually, blood pressure is really low.
Oh, really?
80/60.
Oh, no.
Are you experiencing any dizziness?
Not usually, but sometimes with the headaches. When I have the headaches a little bit.
Do you have headaches right now?
No, earlier in the day, but I'm fine now.
All right, so blood pressure 80/60. Let's go ahead and take your pulse. I'm going to put 2 fingers on your wrist. Okay, and we're going to go ahead and compare. Two plus. All right. Capillary refill is within 2 seconds. That's really good. All right, so taking a look overall at your appearance, I'm not noticing any distress, normal color, no cyanosis around your mouth, face is symmetric as well, and you carry your body in a symmetric way. And I'm going to go ahead and just palpate your head to see if there is any asymmetry or any lumps.
Okay. Yeah.
Okay. Okay, I'm going to go ahead and palpate your neck. We're looking for any lymph node enlargement. Can you please shrug your shoulders? Okay, good. All right, you can go ahead and relax. Okay. Palpating sinuses under your eyes. Nose is a little bit asymmetric. I'm going to take some measurements. Okay, so head circumference is 60.5. Okay, we're going to measure your arm. So we're looking for any symmetry between left and right as well, to see if there is any type of swelling. Also to see if there is a proportionate length of your arms compared with the torso. All right, go ahead and put your arms a little bit like this. I'm going to measure your waist. Okay, you can go ahead and put them back down. Okay, everything looks good. I'm going to listen to your heart and your lungs. Okay, this is going to feel a little bit cold. Is it okay if I slide the stethoscope under the shirt?
Yes.
Okay. And is it okay if I put the stethoscope under the shirt on the lower side?
Yes.
Okay, I can hear only S1 and S2, no S3, no S4. Let's go ahead and check with the bell. We're looking for any murmurs, since we're definitely concerned about having hypertension in the family. We want to be able to catch this ahead of time. Very good. So no murmurs. I'm going to listen to your lungs. Go ahead and take a deep breath in for me. And exhale. Good. And again, take a deep breath in. And exhale. All right, I can hear only bronchial sounds. I'm just going to listen to the side. Take a deep breath in. And exhale. And again, breathe in and exhale. Okay. Are you wearing contacts?
Yes, I am.
Okay. I'm going to flash a light in your eyes. Go ahead and look straight at my nose. Okay, very good. Can you please follow the light with your eyes only? Don't move your head. Okay. Okay. And I'm going to check your ocular nerve as well. For this, I'm going to ask you to look behind me straight at the wall. I'm going to come very close to your eye and examine. Just try to keep your eye open and keep focusing on the back wall. Very good. Perfect. Okay, looks very good.
Okay. Awesome.
Okay, I'm going to check the back of your throat now.
Okay.
So we're looking for any swollen lymph nodes. Okay, go ahead and open your mouth and give me a big ah. Alright, there is no redness. Everything looks very good. You have less midline. Can you please move your tongue up and down for me? Up and down. Any difficulty?
No.
Side to side. Okay. Can you push with your tongue inside your cheek? And the other side. Okay. Can you give me a big smile? And frown. Frown with your eyebrows. All right. Let's go ahead and try to frown again. Okay. Now go ahead and raise your eyebrows up. I'm going to try to push them. Don't let me do that. Go ahead and keep them up. Very good. Okay. I'm going to try to move your head to your right. Don't let me do that. Good. And same thing with the other side. Good. Can you please shrug your shoulders? Okay. Can you squeeze my fingers? Okay. Put your arms in front of you just like that. I'm going to try to push them down. Don't let me do that.
Okay.
Okay. I'm going to try to open them. Don't let me do that. Good. I'm going to try to close them. And I'm going to try to push them up.
Okay.
Go ahead and relax. Okay. I did notice a deviated septum. Do you snore at night?
Not usually.
Okay, that's a good sign. Sometimes people are just born like that, or if you had an accident that you maybe don't remember, it was in your childhood, something like that could trigger. But let's go ahead and take a look and see if there is any obstruction, okay?
Okay.
I'm gonna have you look up. Go ahead and look up for me. Okay, looks good. Okay, very good. Okay, we're going to check your hearing. Can you please tell me when you don't hear this sound anymore?
I don't hear it. I don't hear it.
Can you please tell me which position here is louder? 1 or 2?
2.
1 or 2?
2.
Okay. Okay, I'm going to check inside your ears. This is part of the annual exam. Okay. The bonding membrane is broken. No signs of infection there. Very good. Just a little bit of earwax, but nothing to be worried of. I'm going to go ahead and palpate your arms. We're looking for anything swollen. Okay. I'm going to go ahead and check your back now. I'll have you face the wall.
Okay. All right.
All right, I'm going to go ahead and take a look at the spine. So we're looking for any signs of deviated curvatures. I'm not feeling any kyphosis around the neck area, which is great. Okay, go ahead and try to touch your chest with your chin. Okay, perfect. So this just accentuates the curves. Okay, you can come back to center. I'm going to touch you with 2 textures. Can you please tell me if this feels sharp?
Yeah, that was a little sharp.
Okay, and this is going to feel dull or fluffy. So go ahead and tell me if this feels sharp or dull.
That was sharp.
What about now?
That was dull.
Okay, so go ahead and just say sharp or dull from now on.
Okay. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull.
Okay. I'm going to take some measurements. 27. 14. Okay. We're looking for any abnormal responses. Okay. Any pain as I was tapping you over here?
No, I'm just too ticklish.
Okay. Go ahead and take a deep breath in. Breathe out. And again, take a deep breath in. And breathe out. One more time. Breathe in. Exhale. And again. Okay, I'm gonna have you lay down and I'll examine your abdomen. Okay, Nicole, I'm gonna go ahead and check your abdomen as well. Is it okay if I open the jeans a little bit so I can take a look at the lower side? All right. Okay, so we're looking for any asymmetry. No pulsations. I'm going to listen for any aortic regurgitation. Normal percussion sounds. Checking liver for any inflammation or organ enlargement. Okay. Checking right ovary and left. Good. Okay, everything looks normal. I'm gonna go ahead and take a look at your legs and feet as well. I'm going to go ahead and remove your socks and I'll place them here on the floor. All right, we're going to check pedal pulses first. Good, 2+. We're looking for any edema. I'm not seeing any swelling. Looking between the toes for any discolorations. Capillary refill is within 2 seconds and bilateral warm temperature. Okay, we're going to check Babinski reflex. Okay. Okay. good. All right, I think that looks good. Let's go ahead and check your reflexes. So for this, I'm going to ask you to go ahead and bend your knee and put it on top. There you go, perfect. So just keep it like that. Okay, good. And we'll do the same thing on the other side. Just a little bit lower. Okay, that was normal. I'm going to have you sit back and we're going to check your other reflexes. Okay, we're going to check your other reflexes. Go ahead and relax your jaw. So kind of like lower it a little bit. Perfect. Even a little bit more. Too much? Okay, great. Good. And we're looking for hypo or hyperactivity. Good. Okay. Relax. Very good. Very good. Okay, perfect. We're going to order some blood work for you. It's part of the annual exam, and we're going to check your troponins just to make sure that you're not having any heart problems.
That's fine.
Your back and your abdomen sound very good. Everything looks healthy, and I'm not concerned at all. Do you have any questions for
great.
me?
No questions at this time. Thank you so much.
You're welcome. Okay. I will call you back with the blood results, and we'll go from there.
Awesome. I look forward to your call. Thank you.
You're welcome. Hi, Nicole.
Hi.
How are you?
I'm okay.
Okay. I'm sorry you're not feeling that well. I'm going to first verify your date of birth. Is that okay?
It's gonna be April 21st,
Okay.
2004.
Perfect. And can you please verify your last name as well?
Smith?
Okay. Go ahead and tell me what's going on with you today.
So I've been having some really bad pain, like right here under the arm, and I guess this side of my arm in general has been not feeling well, I guess. I fell a couple days ago on my bike, but I didn't think much of it, just scraped my knees. But ever since, my arms just felt really tingly and weird.
Okay. Did you lose consciousness when you fell?
I don't think so. Nobody was there, though.
Okay. Any pain in the back?
I have a little bit of pain on, like, my left shoulder.
On a scale of 0 to 10, how would you rate that pain?
Like, 6.
Have you been taking any medicine to help with that?
Just, like, ibuprofen.
Okay. And any facial pain?
I don't know if this counts, but, like, right here, I guess that's where my face meets my neck. I've been
Okay.
having it on the same side as my shoulder, just, like, right there.
And it started right after the accident?
Yeah.
Okay. Are you taking any medications on a daily basis?
I take Adderall and I take birth control.
Any surgeries?
No.
No surgeries. Okay, I'm going to put some gloves on. And are you experiencing any shooting pain down the spine?
I would say down on the higher part of my spine, probably down from my neck.
Any flu-like symptoms right after the accident?
No.
Okay, this is going to go sublingual under the tongue. I'm going to have you hold it for me, okay? Go ahead and lift the tongue up a little bit. Good. And now close. And can you hold it for me? Perfect. Thank you. This will go on your index finger. Okay. Okay, just a little bit longer probably. I'm going to slide this up. Okay. 98.3. That's normal. Okay. Blood pressure is 98/65. Systolic is a little bit low. Okay. Heart rate is 59. Oxygenation 97%. Okay. Do you feel dizzy at all?
A little, yeah.
Did you drink anything hot when you came in?
I had some tea this morning.
Okay. Okay. I'm going to go ahead and just palpate your neck and your face. I'm going to move the hair in the back. Okay, go ahead and shrug your shoulders. And keep them shrugged for me. Just keep them like this. Okay, you can relax. I'm going to palpate your arms. So I'm looking for any bruising. And you mentioned that you scraped your knees as well. I forgot to ask you, were you wearing a helmet?
Not really, no.
Okay, no worries.
Yeah, my mom was really mad at me about that.
Okay, and I'm going to check your knees as well. Okay. And your neck in the back here. Okay. Can you go ahead and look straight at my nose? Pupils are kind of dilated and a little bit uneven. Okay. Go ahead and look right here for me. And look here. Okay. Can you give me a big smile? All right. And frown. Puff your cheeks. Keep them puffed. Don't let me unpuff them. Okay. No worries. All right. Now I'm going to go ahead and close one ear. Can you breathe in, breathe out through your nose? Okay. Same thing on the other side. Okay. All right. I'm going to check inside of your mouth. Go ahead and give me a big ah. Okay. Uvula's midline. Can you go ahead and try to push this wooden spatula with your tongue? Go ahead and open, and now push the spatula. Good. And on the other side. Okay, good. Okay, I'm going to have you cover one eye. And with the other hand, can you please hold this Snellen chart? And I'm going to have you extend your arm all the way. Perfect. So I have here two colors. I'm going to need you to tell me which color is to the left side.
Red.
And what color do you see here?
Green.
All right. Now, can you read this last row?
Not really.
Okay, I know you're not wearing contacts. Do you have a prescription for glasses?
I do, but I don't wear them that often.
Okay. Can you try and read this last row?
ITEBH.
Okay. Can you tell me what number you see right here?
6.
Okay. What about here?
5.
Okay. And which circle is bigger? This one or this one?
The first one.
Okay. Go ahead and switch eyes. Okay. Extend your arm all the way. Can you go ahead and read the same row starting with the letter to the right?
HPFTL.
Okay. And what color do you see here?
Red.
And here?
Green.
What number do you see here?
9.
What number do you see here?
3.
Okay. Which circle is smaller? 8 or 9?
8.
Okay, perfect. Okay. Now, can you try and read these numbers right here? So without trying to make your eyes like this. This is how you're trying to focalize, which I understand. So
47.
Okay.
28.
Okay.
34.
Okay.
62.
Okay.
48.
Okay.
26.
Okay.
5.
Okay.
52.
Okay. Have you noticed any changes with your smell?
Smell? A little bit. I haven't been able to smell much.
And that's mostly from the accident or even before?
It happened actually before.
Okay. Go ahead and try to taste this for me. and tell me what it tastes like for you.
Peppermint.
Okay. What about this one?
That doesn't taste like anything.
Okay.
It tastes sweet, like fruit. It's bitter.
Okay. So there were some that you kind of got them wrong, and you're right. Your taste is a little bit off. I do have some smells as well that I would definitely want to check here. Okay, I'm going to have you close your eyes. And I'll give you a few pretty strong smells, I would say. And I'm going to have you identify them, okay?
Peppermint.
Okay.
It's like bitter, like oniony kind of smell.
Okay.
I don't really smell anything.
Okay.
Like a light lemon scent, maybe.
Okay.
Like flowery kind of.
Okay. You can go ahead and open your eyes. And yeah, the smell, definitely there is some olfactory damage there, which makes me think that you might have hit your head and even lost consciousness when you did, and you did not realize. It might have been just for like 10 seconds that it happened. Okay. What I'm going to have you do now is I'll have you lay down, and I'll start with the scalp and move down the body to see exactly where we can pinpoint the nerve damage. Okay, I'm going to go ahead and just find a hairline here. So I'm going to touch you with two textures. Go ahead and tell me if this feels sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. 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 Dull.
Okay, and does this feel cold or warm?
Cold. Cold. Cold.
Does that feel cold in all three parts the same?
It was colder at the end.
Does this feel sharp or dull?
Dull. Sharp.
And does this feel cold or warm?
Cold. Cold. Cold.
Does this feel sharp?
Mm-hmm.
And does this feel sharp all the way?
Yeah.
And does this feel sharp or dull?
Sharp.
And now?
Yeah.
And now?
Mm-hmm.
Does this feel sharp?
Yeah.
Does this feel sharp all the way?
Yes.
Does this feel cold or
Warm.
warm? And now?
Warm.
And now?
Cold.
Just gently palpating to see exactly if there is anything swollen. Can you go ahead and take a deep breath in and exhale? Okay. One more time. Breathe in and breathe out. And again, take a deep breath in and breathe out. And again, breathe in, breathe out. Again. And again. No punctured lungs. Can you please tell me when you don't feel this vibration anymore?
It's stopped. It stopped. It's done. No. No.
Okay, a normal conductory message. Can you please tell me if you feel this on the left or right?
Right. Left. In the middle. In the right. In the middle. On the right. On the left. Down the middle.
And can you tell me which one you feel sharp or dull?
Dull. 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 It's a little sharp. Dull. 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 Sharp. Dull. Sharp. Sharp. Dull. Dull. sharp, dull, dull, sharp, sharp, dull, sharp.
I'm going to be drawing two shapes, one on the right side, the other one on the left side. I'm going to need you to tell me what shape you can identify, okay?
Okay.
Okay, what does that feel like?
Like a star.
Okay. And now?
I don't, maybe a square.
Okay. Can you tell me what letter I'm drawing?
T. C. F. G. B. Q.
Okay. I'm going to touch you with two textures. One is going to feel dry, the other one is going to be wet. So I need you to tell me which one it feels.
Wet. Dry. Wet. 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 Dry. Dry. Wet. 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 Dry. Dry. Dry.
Now go ahead and tell me if you feel two or one pressure point.
One. 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 Two. Two. One. One. Two. Two. One. Two. Two.
Just going to use simple percussion here, looking for any fluid buildup. Okay. Okay, Nicole. Unfortunately, there were some inconsistencies, and I'm a little bit worried about your spine. I forgot to ask you if you've been experiencing any headaches. Okay. So I am afraid that you are at risk of some mild seizures, and we do want to send you to the hospital. So as soon as you can, I'm gonna have you go to the area where we can take our patients to the hospital just to have them checked. I want to make sure that everything is okay before you go home. I'm gonna run some tests and see what the results are from the CT. And are you allergic to anything? Okay, so we're gonna run a CT with contrast just to make sure. It's gonna be of the head, neck, and upper and torso. Okay. Is there anything that you are concerned of right now? Do you have any questions for me?
No, I'm okay.
Okay. Would you like me to call any family members for you?
Could you call my mom for me, please?
Yeah, absolutely. We can do that.
Thank you.
You're welcome. So I will see you soon. Don't go anywhere.
Thank you.
You're welcome. Go ahead and put gloves on. And first, take a look at your scalp. I am noticing a little bit of redness at the base of the scalp near the cervical spine. I'm going to start by palpating C1, looking to see if there is any distension on the atlas. Moving down to axis, C2 doesn't seem to be misplaced. Feeling a little bit of decreased mobility on C3, following on C4 and C5. Noticing a little bit of soreness, starting with T1. Checking for spine misalignment. No signs of scoliosis. No deviations of the spine to the left or right. It does seem to go to the left about a 3-degree angle, but we can definitely keep that under radar and monitor. And your pain, you said, is mostly on the left side. When I looked at the picture, yeah, it did seem that you're having more pain here, lateral on the collarbone and scapula. Also checking scapular mobility. Okay. Okay. I'm going to gently slide my fingers kind of under. More mobility on the right side. Compared with left. Go ahead and slowly try to touch your chest with your chin. Slowly. So we're looking for any cracking sounds. And come back to normal. And we'll do that one more time. And come back to normal. And again. Okay. We're looking to see if this is neurological, like a nerve impinged, or muscular. Let me know if you feel any kind of pain. Go ahead and tell me when you don't feel the vibration anymore. There. Okay. going to go ahead and start measuring. We're looking for signs of inflammation and asymmetry along the paraspinal muscles. I'm going to focus around these 3 points. I'm going to touch it with 2 textures. One is going to feel dull, the other one is going to feel sharp. Go ahead and tell me what this feels like. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Dull. Okay, Nikki, I'm going to go ahead and focus on the points that first trigger you some pain, and I did notice some tension. The first technique that I would like to use is skin pulling. So what that does is to release some of the tension that is accumulated behind the first layer of the skin, and it really helps to bring in nutrients and circulation to the area. That usually improves the pain level and tension in the muscles. Also, if you do have some knots that could be released through this technique, that's when we can go ahead and tackle them. I'm going to apply an anti-inflammatory oil. This is going to feel a little bit warm. to use cupping to increase circulation in the left scapula. You might see a little bit of redness in the upcoming days, just so you know it's normal and it was caused by the suction. Working on the lymphatic drainage as well to help stimulate the release of lymph. This usually helps to bring down swelling. to apply acupressure therapy. This is a sensorial massage. What it does is it helps to stimulate the nerve endings that come through the dermis. And now we're going to take a look at your hair and scalp. ahead and tell me if you feel this sharp or dull.
Dull. Dull. Sharp.
And do you feel this sharp all the way?
Yes.
Does that feel sharp?
No, dull.
And now?
Dull.
And now?
Dull. Dull.
Does this feel cold or warm?
Cold.
Does this feel cold or warm?
Cold.
And now?
Warm.
Go ahead and tell me if this feels sharp or dull.
Sharp. Sharp. Dull. Dull.
And does this feel cold or warm?
Warm.
And now?
Warm.
What about now?
Warm.
Does this feel sharp?
Yes.
Does this feel sharp all the way?
Yes.
Okay. We're gonna go ahead and do a scalp massage before we do hair pulling. we're gonna go ahead and do hair pulling therapy. That's what we're trying to do, is to create that tension and stabilize the spine. Okay. Okay, we are done for today. I'm going to schedule you for another session in about 2 weeks. Thank you for letting me do this exam on you, and I'll see you back soon.